Healthcare is an integral part of life for countless human beings across the globe. It is essential for a long-lasting and high-quality life. Many countries have adopted what is called universal healthcare, which is a healthcare system that allows all residents within that country access to the healthcare they need despite their financial status. The United States has not embraced this system and relies on a health insurance or a person's own finances to pay for healthcare. This has negatively affected so many lives across America and should not be tolerated. The United States should implement universal health care because of the negative consequences caused by the current structure on its citizens, the financial stability it could bring to millions, and the fact that adopting this system is possible. One component of American healthcare that has had negative consequences is health insurance. Without insurance or without one that covers the right services, an American citizen may not be able to afford the health services they require. This sort of system is very unfair for many who just want to be healthy. I have witnessed myself the ways in which insurance companies have impacted others' lives. A previous coworker of mine suffered from an autoimmune disease which caused severe pain every day. Their insurance company would not cover the medicine she needed to alleviate her pain. She had to accept the fact that there was a treatment that could improve her quality of life, but she would not be able to have it. Andre and Velasquez of Santa Clara University give an example of a negative consequence of the current system in their article called A Healthy Bottom Line for Profits or People. They state in Alameda County, a private hospital turned away a woman in labor because the computer showed that she did not have insurance. Hours later, her baby was born dead in a county hospital. Hospitals and clinics can make rash decisions like this to turn away patients if they find that they will not make a profit from caring for them. People who experience this occurrence have a chance of losing their lives because of it. Insurance companies can halt or deny coverage for many reasons. Denial of coverage can widely vary across different insurance companies and state to state, with denial rates ranging from 1% to 80%. Opponents of universal healthcare argue that the wait time to get care would increase significantly. There is evidence that suggests that this assumption is false, and that the wait for healthcare services in countries with universal healthcare is not as lengthy as they think it might be. In Waldrop's article, The Truth on Wait Times in Universal Coverage Systems, he states, in the United States, 4% of patients reported waiting 4 months or longer for non-emergency surgery, compared with only 2% of French patients and 0% of German patients. While there would be certain circumstances where universal health care would cause someone to wait for longer for care, the availability of such health care would outweigh any negatives brought about by a longer wait. With easier access to all medical services, Americans could get a head start in taking care of their medical needs before they worsen. Epidemic levels of chronic diseases could be taken care of across the country. There would be a lot more peace of mind and much needed help for anyone requiring health services. Another downside of the current system is that it's costly for both the American government and its people. The U.S. spends a lot more on healthcare than any other first world country. According to the Office of the Actuary, healthcare spending in the United States has been $4.7 trillion per year since 2020. This is a 9.7% increase in spending from the year 2019. It is also estimated that there will be an average of 5.5% level of growth per year. This will result in $6.0 trillion in spending on healthcare by the government per year by 2027. Advocates of universal healthcare believe that this spending could be reduced with a universal healthcare plan called Medicare for All. In a research report named Economic Analysis of Medicare for All, it is stated that Medicare for All spending would be approximately $37.8 trillion between 2017 and 2026. That amounts to about $5 trillion in savings over time. These savings would come from reducing administrative costs and allowing the government to negotiate prescription drug prices. American citizens have spent a large amount of money on healthcare as well. It is estimated that 1 in 10 adults in the U.S. owe a large amount of medical debt. Around $195 billion in medical debt annually is owed by Americans. Those with universal health care do not have to worry about this issue because of the taxes they pay. In Germany, about 7.5% of the citizen's salary is used towards taxes for health insurance. If this were the way Americans paid for health care, someone with an annual salary of $50,000 would have to pay $3,750 in taxes per year. That person would pay that amount and not have to worry about any other medical expenses, which could add up to be even more costly. According to a poll from the Kaiser Family Foundation, almost half of American adults would not be able to pay for a sudden medical bill of $500. The American government and its citizens would benefit from saving money and having less debt through universal health care. Opponents of universal health care are also concerned with the difficulties of implementing universal health care in America. They are worried it would not be feasible in a country as large and diverse as the U.S. Following the example of universal health care in Germany would help overcome this issue. In an article, A Better Path to Universal Health Care discusses this option. Germany has a model of health care that builds more naturally on the American health insurance system. Germany has a multi-payer model of health insurance which is similar in certain ways to the American insurance model. Citizens of Germany use health insurance like Americans do, but according to DA, workers and employees share the cost of insurance through payroll taxes, while the government finances coverage for children and the unemployed. Medicare, which is a government-funded health insurance program for certain qualified individuals, contains the foundations for this system, since it also uses taxation to cover services. A system like Medicare could be expanded on to be able to cover more Americans. Insurance companies would still be present, but they would be more heavily regulated so that patients would not need to pay as much. A complete overhaul of the current system would be less feasible than improving upon the current one. Changes like these would be difficult to execute right away, but their long-term effects could be beneficial and necessary to anyone in America requiring health care. Universal health care will create significant far-reaching and positive changes in the United States if put into practice. The negative consequences of the current system on its citizens, which include the necessity of insurance and the variability of coverage, could be resolved, resulting in the improvement of Americans' health. Universal health care would also help America and its people save money and overcome medical debt, and the current system could change to universal health care through the example of the German healthcare system and transformation of Medicare. Wouldn't you want to live in a country where healthcare is a right and not a privilege? This is already a reality for those who are fortunate enough to have access to it and should be extended to American citizens as well.